All right. Hi, everyone. Welcome to the CoE webinar series. I'm Alice. I'm here from the Colorado Integrated Food Safety Center of Excellence. And thank you all so much for joining us today. So this is the first of 5 webinars that the 6 Integrated Food Safety Centers of Excellence will be presenting. The COEs will host a webinar every other month over the next year to introduce the products and services we offer on foodborne outbreak investigation. So just a few logistics today. Everybody should be calling in on mute, and just make sure that throughout the presentation you stay on mute. If you have any questions or comments throughout the presentation, please feel free to enter them in the chat box, and we should have some time at the end to take any questions. Also, following the series today, we'll be circulating, sorry, the beeps are ramping up, so following the series today, we will be circulating a brief survey to get some feedback from you all on the webinar series, as well as your input on some of the future webinars. So we'd like some feedback on which hot topics you would like to hear from the COEs on. Keep an eye out for that after the webinar ends today. All right. And just a reminder to please stay on mute throughout the presentation. And just so everyone knows, all of the webinars will be recorded and posted to our website, coefoodsafetytools.org. And with that, I'd like to introduce our presenter today, Dr. Elaine Scallon. Dr. Scallon is an associate professor in the Department of Epidemiology at the Colorado School of Public Health at the University of Colorado Anschutz Medical Campus, where her research focuses on the burden of foodborne disease. Dr. Scallon is the co-director of the Colorado Integrated Food Safety Center of Excellence. And prior to this Colorado School of Public Health, she was the team lead for the Foodborne Diseases Active Surveillance Network, or FoodNet, at the Centers for Disease Control and Prevention in Atlanta. And with that, I'll turn it over to you, Elaine.
Great. Alice, can you hear me okay?
I can, yeah.
That's wonderful. Well, it's just great to hear all the beeps. Thank you so much for your interest in this presentation. So as the first in the series, I have the pleasure of giving you an overview of the centers. So this webinar will focus on outlining some of the resources and tools that we have available for outbreak responders. So here's what I hope to cover over the next 40 minutes or so, leaving time for questions. I'd like to briefly introduce the Integrated Food Safety Centers of Excellence for some of you who may not be aware of our mission, to give some examples of the training tools and other services that our center provides, so a high-level overview, and then explain how to access these products and services. So the COEs began in 2011 or 12. They started with the Food Safety Modernization Act, or FSMA, which we're all very familiar with. So this was signed into law in January 2011, and one component of this law directed the CDC to designate Centers of Excellence, Integrated Food Safety Centers of Excellence. So here we've just highlighted some of the legislation that is part of establishing these centers. And you can see from this, our mission, our goal was to serve as resources for federal, state, and local public health professionals who respond to foodborne illness outbreaks, and to provide assistance to other regional, state, and local health departments. So I've underlined the word other because unlike some of the other CDC programs that you may be familiar with, like FoodNet or FoodCorps, really the COEs are funded to reach out to other health departments outside their own jurisdiction. So really outward-facing focus. So there are currently 6 CoEs throughout the country, and I've highlighted some here on the map in blue. So FSMA required CDC to designate 5 centers, and initially Colorado, Florida, Minnesota, Oregon, and Tennessee were chosen to begin this process in 2012. The project, the scope of the centers was expanded in 2015 through another competitive application process to add New York, and this was because of an underrepresentation in that northeast part of the United States. So as directed under the FSMA legislation, each center is a partnership between a state health department and at least one academic institution, as you can see listed here. So all of the Integrated Food Safety Centers of Excellence, or CoEs, their goal is to build health department capacity, so that could be at the state level, or could be at the local level, but to build health department capacity to track and investigate outbreaks of foodborne disease. All of the CoEs serve as a resource for public health professionals, and public health professionals involved in outbreak investigations. This includes epidemiologists, environmental health professionals, laboratorians, public health nurses, really anybody who is involved in doing outbreak investigations. So all the CoEs serve as a resource to these public health professionals engaged in foodborne disease outbreak investigations by providing assistance during an outbreak or other projects and training. So all the CoEs do this, though each of the CoEs has now developed to have slightly different focus areas. So as we'll see later when we talk about how to connect with the CoEs, the CoEs work together in a very collaborative way, and all provide some basic assistance and other resources, but there may be one CoE that specializes in a particular topic, for example, complaint systems, where one might focus in another topic around, for example, whole genome sequencing. So there are different areas of expertise, and we expect and would hope that someone in California could work with the CoE closest to them in Oregon, or maybe working with a CoE in Florida. And as you'll see, many of the products that we have developed, particularly around training, are available online nationwide. And we'll talk a little bit more at the end of the presentation about how to make those connections and identify the resources for your local or state health department. So for the purpose of today, I have categorized my examples into trainings, which I'll show you in a moment, kind of have a range of different modalities, tools, and then technical assistance. And my goal today is to share some examples of the range of trainings that we provide, the types of tools, and the types of technical assistance that is available to you through the CoEs. So I placed some of my examples into these buckets. So these represent many of the things that the CoEs have developed, but it's certainly not comprehensive. So the goal today is to give you a sense of what some of those trainings, tools, and technical assistance opportunities are. So today I'd like to highlight some of our trainings, and I've put them under different modalities, including webinars, videos, case studies, in-person trainings, online trainings, and then live learning series. There's some tools I'd like to highlight, and again, some examples of technical assistance. And as Alice said at the beginning of this webinar, please, as we go through these tools, let us know in your evaluation if there are particular areas that you'd like to focus on for some upcoming webinars, and we can certainly do that. So obviously we're presenting this webinar, and webinars offer a great opportunity and way for us to share some of the tools and other resources developed by the CoEs. We are also offering webinars when there are topical issues that emerge around foodborne illness outbreak investigation and response. Webinars offer a very timely way for us to provide outreach on those topics. Most recently, the CoEs have offered a series of webinars for non-laboratorians around next-generation genome sequencing. So this was identified in our needs assessment as something that epidemiologists wanted more training on, how to incorporate this new technology of whole genome sequencing into their detection and response to foodborne disease outbreaks. So this effort was led by New York and involved all CoEs and also CDC. There are a whole series of webinars that were rolled out this spring that talked about implementing whole genome sequencing. And these were accompanied by some training modules that were prerequisites for the webinar that you could watch to really get the basics and some of the language around this new technology. So again, these were rolled out in the spring, but are available and have been recorded and are hosted on the New York website, which I've listed there. So that's a great example of how we're using webinars for some of these topics. Videos can also be a great way for providing basic or introductory information when training perhaps novice employees in the area of foodborne disease outbreak surveillance and response. And for this example, I wanted to highlight a series of videos that were developed by the Florida CoE. So these were developed really focusing on that novice outbreak investigation team member. So perhaps somebody is part of the EPI team or environmental health, somebody who's going to work on outbreak investigations. And this series is meant to introduce them to the concept of foodborne illness, surveillance, and outbreak response. So there are 7 videos that are planned in the series. Some have been released. These include an introductory video giving the historical perspective on changes that have occurred within the food industry and the effects on public health and food safety. There are also a number of series that are planned, and one that is available now talking about surveillance and outbreak investigations from the perspective of an epidemiologist, and another video outlining the role of different federal partners in foodborne disease outbreaks and food safety in general. So really, these are excellent short videos that can be used, for example, for a new employee, or if any of you are teaching courses or involved in training students, a good resource for those people. I think case studies is an example of something else which has a proven history of success when training public health professionals around outbreaks, whether this is a new team member or perhaps...
Hey, Elaine, it's Alice. I'm sorry to interrupt you. It seems like we've lost your shared screen. I can still hear you just fine, but if you wouldn't mind trying to reshare your screen.
Absolutely. All right. I think we need Dana Murr-Smith to stop sharing content.
Okay. A participant might have accidentally shared their screen. Oops. Okay. Yep, we've got you back. That looks good.
Okay. Wonderful. All right. Great. So case studies, I think, are a really proven way of training public health professionals. Perhaps if there's hasn't been an outbreak recently, or you want to make sure skills in a particular outbreak type are up to date, case studies can be a really useful way of training existing or new team members. So many of the case studies have been a great resource for all of us, but one thing the CoEs have sought to do is to develop some more recent outbreak examples, which highlight some more recent methods and also more recent laboratory diagnostics and how those are incorporated into outbreak investigations. So I want to highlight work from 2 different CoEs here. One, in Minnesota, they have developed an outbreak investigation series, which is focused on the methods used by epidemiologists to generate, develop, and confirm a hypothesis around an outbreak. So these are mainly focused on multi-state outbreaks. Each case study begins with a description of how that cluster was detected and brings the investigator through the outbreak to the end where the food source has been identified and there's a level of confidence that allows you to implement public health interventions as part of the outbreak investigation. So as I said, these are focused so far on multi-state outbreaks, and 3 are available currently, one on listeria associated with soft cheeses in 2013, one with E. coli 157 associated with hazelnuts, and another with E. coli 157 associated with ground beef. Recognizing that complaint-based outbreaks are also an important way in which we detect outbreaks of the foodborne illness, the Colorado CoE has also developed a number of case studies that have that more complaint-based local health department focus. 2 are currently available, including one that looked at edibles infused with marijuana. And while most are paper-based, we do have one that's available online, so a new employee could take that alone as part of this computer application. So for in-person trainings, I would like to highlight our EpiReady trainings. And I'm sure many of you are familiar with EpiReady. It's a much loved and appreciated training. Have you lost me again, Al?
Yeah, I think you'll have to reshare again, and I just changed the setting, so that shouldn't happen again.
Okay, unfortunately, it doesn't seem to be letting me share my screen. Can you check that I'm the host?
Yep, I'm just switch something, and maybe try again. Do you see the option to share your screen?
No, unfortunately, it's not letting me hit the screen option. Okay, got it now.
Okay.
Okay, so in-person trainings, because sometimes technology can be challenging. EpiReady is a really much-loved training. It was developed by CDC in collaboration with NEHA. It's a team-based training offered over 2 days, and this is something that now all of the Colorado CoEs have had members trained in, and now they can offer that training. So this is a really good example of one of the trainings that is offered in person. So one of the things that we have noted in the needs assessments that we've conducted across the different regions is that while somebody may want to go to EpiReady, in some jurisdictions it's not possible because of time and resource constraints. So maybe there's not the money to travel to an in-person training, or perhaps that one person really can't be away from their work for 2 days in order to conduct the training. So to address that gap, the Tennessee CoE has developed a series of online courses around foodborne disease outbreak detection and response. So much of the content draws from the best parts of EpiReady and makes that available in an online course format. So there are 7 courses that are planned. 3 are currently available that go into the foodborne outbreak investigation and the roles of different team members. So these are really nice interactive courses. They have quizzes, they have videos built into them, they have quizzes at the end where you can assess your knowledge gained through the course. And Tennessee is also working on developing some synergistic in-person activities that your team could do while also taking this online course in parallel. So really a great thing to do for employees who maybe have missed out on that opportunity for in-person training, or to do as a team working through some of these in-person activities while also reviewing in their own time the online course material. The Colorado CoE has developed a couple of trainings that are focused on our colleagues in environmental health. So one is it's called our Quick Train series, so the Quick Train on Environmental Assessments. And hopefully, as the label conveys, this is meant to be a short training on environmental assessments for public health professionals working in environmental health, and it really focuses on 4 different modules, introducing the environmental health professional to outbreak investigations, giving an overview of environmental assessments, also focusing on contributing factors, and then collecting clinical and environmental specimens. So each is short. It takes about an hour to complete all 4 modules. They're self-paced. They have quizzes and other interactive pieces to the training, and there's a certificate of completion and continuing education credits available for that training through NEHA. We've also developed a just-in-time training, again focused on environmental health professionals conducting environmental assessments as part of a foodborne illness outbreak investigation. But our goal with this training was to really break that environmental assessment into discrete tasks, and compiling something where an environmental health professional could go to interviewing or doing a review of the facility, breaking it into tasks, giving very specific tips and advice on what should be focused on when completing that task, and also importantly giving them some templates or other things that they could download and print and bring with them while doing that environmental assessment. So this is meant to be a just-in-time training, and we had the pleasure of developing it in collaboration with NACCHO for environmental health professionals who need something on the go and perhaps are not doing environmental assessments on a frequent basis. So the last training that I'd like to highlight today is Live Learning Series. So Live Learning Series try to bring the best of in-person and the best of online together. So what do I mean by that? I think one of the things that we love about in-person that we miss when we do something online is that peer-to-peer engagement, that connection with others, that opportunity for discussion around a particular topic. But in-person, as we've just discussed, can be challenging sometimes in terms of time and resources. So doing something online using bidirectional video, as we have an example here of one training, allows people to see each other face-to-face, to have that discussion, even though they may be geographically located in different jurisdictions. So the Colorado CoE has launched a number of these live learning series. Some have been ECHO learning communities, which some of you may be familiar. ECHO, our extension of community health outcomes, is something that's used frequently now in the medical world. We've translated that into the public health world. Each of these uses bidirectional video, has some an expert giving some small didactic, but most of the training is based around cases. And for us, a case has not been the patient, but the outbreak. So it gives an opportunity for members of our community to bring examples of outbreak investigations that may have been challenging and work through with their peers what they may have done or what they would do in the future. So we've run some around hypothesis generation, interview skills, and we're just about to launch one on whole genome sequencing, which we hope will build on the online modules and the webinar series that was led by New York, and give epidemiologists really hands-on experience to work through some very specific case studies, incorporating that new technology into their work. So I'd like to shift now from trainings to tools. And I see the difference. These tools are something that live online and something that you can go back to over and over again. So it would be a reference for the work that you're doing. So just 3 examples here. The first is the Food Source Information Wiki, which was developed here in Colorado. And it was really developed on foot of the cantaloupe and listeria outbreak that we experienced in our state. It was a multi-state outbreak, but the cantaloupes were grown here in Colorado, and that's where most of the cases resided. So when cantaloupes were implicated, there was a lot of phone calls trying to figure out how exactly cantaloupes are produced, to understand that process better and to understand what pathogens were previously associated with cantaloupe. But really, that information wasn't readily available in one place online. So that's the goal of the wiki, is to provide somewhere where public health professionals can go, can focus on a particular food and learn about what outbreaks have involved that food in the past, what pathogens has that food been associated with, and it would what were the causes or factors contributing to those outbreaks, in addition to some information about food safety concerns in general about that food and how that food is produced and distributed. And we're always looking for people to contribute to the wiki. It's called a wiki because we're hoping that a lot of the content will come from you all as you investigate outbreaks and become an expert on a particular food, that you can contribute and add and expand on the sections we currently have available. So another tool that's been developed by the Oregon CoE is the International Outbreak Museum. So Oregon developed this museum to inform current and future epidemiologists about notable outbreaks, the food pathogen associations, and evolving methods for outbreak detection and response. So a number of outbreaks are focused on and delved into on this online tool. Each outbreak includes physical or photographic exhibits, goes through the basics of the outbreak, and summarizes the outbreak significance. So in addition to informing investigators and those working in the field about methods, this can also be useful if you want to remind policymakers of the importance of foodborne disease and outbreak investigations, and can also be a good resource for the public. The final tool I'd like to highlight is also from Oregon, Project Mercury, and that collaboration. So this is not something that's currently freely accessible online, but is part of this collaboration. And it's really built on the fact that many of our local and state health departments routinely collect information from cases on food or animal exposures. So, but they mainly live in isolation. The purpose of this Project Mercury is to try and connect these different systems and shed light on them, and making them more useful for all of us by standardizing what we're looking at in terms of the foods or animal exposures, with the ultimate goal of giving public health professionals somewhere they can go to search these data and look at locally specific information on how many people do we expect to have eaten a particular food or to be exposed to a particular animal or other exposure. So thereby giving us some baseline information, so when there is an outbreak, we can use it for hypothesis generating. If we think it's the cantaloupe, is the rate of consumption among our cases much higher than we would expect in the general population? So moving to technical assistance, there are really no end to the types of technical assistance that can be offered, but I just wanted to highlight a few that have been the most popular and frequently used. So this is in addition to some of the trainings This can be picking up the phone, it could be having somebody from one of the centres go visit the site, so really running the whole gamut of technical assistance opportunities. So one example is consultation services. So for example, this could be assistance or technical support during a challenging outbreak. So again, this could be just simply picking up the phone and having a telephone consultation, or more in-depth technical support or assistance with data analysis following an outbreak. In Colorado, we also offer some facilitation services. A good example is around hot washes. So after an outbreak that maybe was challenging or a particularly large outbreak, having somebody from our centres come in and facilitate a hot wash, giving you an opportunity to review what happened over the course of the outbreak, to identify some strengths and some things that you would like to work on in the future. We also offer some technical assistance when jurisdictions would like to assess their needs or capabilities within their jurisdiction. And so one example is around training needs assessment. So the CoEs have developed key informant interviews, also online surveys that are targeted at public health professionals and aim to identify training needs within that jurisdiction. So we have templates that can be shared if you wanted to do that within your own jurisdiction, or could certainly look to helping you implement that kind of training needs assessment in your jurisdiction. Likewise, we have some great resources from C4, such as the C4 Toolkit, which allows jurisdictions to evaluate their own strengths and areas that they could work on with regard to outbreak detection and investigation procedures. So one of the services that the CoEs offer is having somebody from one of our centres, either from a distance or by visiting the site as part of a site visit, to help work through some of the sections in the C4 evaluation toolkit. So the last thing I'll mention around technical assistance, Minnesota has recognized that there are a couple of areas where there are repeated questions, for example, around creating student worker teams, which they have been successful in implementing and maintaining for another number of years. So they have gone about and created a series called Key Points. So some key points or advice on how to implement things like student teams or complaint systems. So covering a whole range of foodborne outbreak detection and investigating topics. So I just want to shift now in this last piece of the presentation towards how to access these tools and other products. So when we began in 2012, really the number of trainings that were available was quite limited. I think we've done a good job of filling that gap in the last number of years. Now there's quite a lot of products available. There's over 100 that are available online across all of the CoEs. So now we're really shifting to figure out how we can best have you access those products. So we've been doing a couple of things in order to help you do that. One is the development of an all CoE products website. So each of the CoEs has their website available, and I'll let you know how to access that in a moment. But for you, the user, it doesn't really matter whether the product comes from Colorado or Oregon, you're just interested in that particular training. So all of the products live in this all products website. We've created some buckets for some topics or types of trainings that have a number of them, for example, environmental assessments or case studies. We've also highlighted a number of different modalities that you may be interested in. So you can go and look at the website and run through all the products that are available, or for example here, I selected environmental assessments and trainings that were available online, and the website will highlight what some of those opportunities are for meeting those specific needs. So again, something we're working with and continue to grow and improve the search capabilities, but hopefully a good kind of one-stop shop for the products produced by the different CoEs. Another thing that we're currently working on is developing a curriculum and competencies to accompany these trainings. So for example, our targeted audience framework. So looking at the different audiences that we are producing trainings for. So this may be by different disciplines or different skill levels. For example, somebody who is new to this work as opposed to somebody who's been in it for a number of years. So what we're trying to do is really identify those different audiences and then link trainings to different audiences. So hopefully we can curate our trainings. So if you have a new environmental health professional who's going to be involved in outbreaks, what are the trainings that are really best suited for that public health professional? We're also developing core competencies for both epidemiologists and environmental health professionals and hoping to link those competencies to some of the trainings that we've developed. So if there is something, a competency that you really want a team member to focus on, that would link to the trainings that would help them develop that competency. So those are some of the things that we're trying to do to better curate and make our products and services searchable online. We're also working to better let you know how to navigate services. One of the ways that we've done that is by breaking the CoEs into different regions. Now, as I said, this is definitely not to segment the CoEs into different regions. We hope that jurisdictions and states will work with whoever the CoE is most appropriate for their needs. But in terms of outreach, so for having us contact you and for having you contact us, having regions has been very helpful. So if you don't know where to start, you know what you're looking for, or you want to just hear more about what the CoEs have to offer, I would encourage you to contact your regional CoE. So they can act as a navigator, they can direct you to services that are offered in their region or services or resources provided by other CoEs. We all work very closely together, so we're really aware of the different activities being undertaken by the different sites. So we can be by picking up the phone and talking to us is a really easy way to figure out how to access those services. So to learn more about the CoEs, there are a number of ways. We tweet, so that's our handle on Twitter. And we also have been producing a quarterly newsletter called Centered on Food Safety, where we highlight new products, new opportunities. We also have a listserv, which I believe many of you are part of. That's how you receive notification of this webinar. And that is how we'll notify about subsequent webinars and other training opportunities that are available. So I encourage you to let others know of that listserv. So the listserv and links to the newsletter and other things are available on the All Products website, so that's coefoodsafetytools.org. Another good place to go as a first point of contact is the CDC website, CDC/food-safety/centers. And there you'll find a link not only to the newsletters and the listserv, but also to the websites for each of the individual CoEs and contact information for the key people to reach out to in those states, including emails and telephone numbers. So I'm going to end there with some time for questions and just conclude with these few points. The CoEs, very outward-facing. Our goal is to assist local and state health departments in improving surveillance and outbreak response. There are many products and services that are available free of cost, and many of them are available online on our All Products website for immediate use and really run the whole gamut. But if you don't know where to start, you can't find exactly what you're looking for, or you have ideas of things that you need, which we would love to hear about, trainings or gaps that you have recognized in your own work, then please reach out to your regional CoE as a starting point and let us know about those opportunities. So with that, I'm going to leave this slide up again for any of you who want to note those websites down. And I think we have some time for questions. And hopefully some of my other CoE colleagues are online, so they feel free to jump in too if they have a better answer than I.
Great, thank you, Elaine. So if anybody has questions or comments, please add those to the chat box. And you can access the chat box on the top right-hand corner of your banner. So I'm not seeing anything in the chat box yet. So Elaine, I'll ask you a question that comes up often, which is, are all of these trainings free, or is there a cost associated with any of them? And are they generally open to anybody who would like to use them?
Yeah, and thank you for bringing that up because I failed to mention it. So yes, any of the products, trainings online are available free of charge. So that's really a wonderful advantage of some of the products being developed by the CoE. So if you go to the CoE All Products page, any of those are available free and for immediate use.
Great, thank you. So I do see a couple of questions have come through. The first one is, are the case studies for in-person format, and do they come with a facilitator guide?
Yes, so first I'll speak for the Colorado case studies. So we've have two available on our website. Both have instructor and student guides, so are that kind of traditional case study format that we're familiar with. We also experimented with having a version that's online that could be taken by a single person, which has some advantages over the paper-based version because it allows them to work with some of the data that was collected as part of an outbreak, but of course is limited because it doesn't really offer the opportunity for dialogue that you can get from some of those paper-based studies. So both of them are available on our website. The Minnesota one is not written in that very traditional way, but they've come up with a really nice way of presenting data from the outbreaks, which does take you through the outbreaks sequentially and does have notes as you continue through the outbreak that answer some of the questions that were posed as part of the case study. So yes, is in that, does provide all the information that a facilitator would need to lead the group through the case study.
Great. So the next question here is, what is the contact information for the regional centers? Specifically, this person is looking for the contact information for Minnesota, and that person is, the primary contact for them is Josh Rounds. To that person, I will send his email to you directly now. And in general, the contact information for all the COEs is available on either one of these websites that's on the screen.
Yeah, so particularly if you go to the CDC website and just click on Minnesota or Colorado on the map, it will come up who exactly are the directors and the coordinators at both the university and the health department site. So there's a number of different people there that you can reach out to.
All right. And then the next question, the comment says, thank you so much for an outstanding presentation. I haven't perused the CoE Tools website recently, but are there any resources related to toolkits for investigating camp outbreaks?
So I am not familiar with anything that's up there specifically around camp outbreaks. But I think that's a really good example of something where I would encourage you to reach out to one of the COEs and kind of ask that question. And then if there are expertise within the COEs or they're aware of others who have been involved in that kind of outbreak, we could certainly help you think through some of those logistics if the outbreak is ongoing. If it's not something that's ongoing but you've identified it as a need because it's a very particular type of outbreak and environment, we would love to hear that suggestion. We're always trying to identify what some of those needs are for trainings or toolkits. So if that's something that you feel is important, we'd love to hear about it and maybe work with you to develop.
Yeah, that seems like a really interesting idea. We'll follow up with the other COEs as well to see if they have suggestions. So the next question is on the wiki. Can you search by pathogen and or food item?
So on the wiki, it's very much orientated to the food. So you would go and look at the articles and search for a particular food. And we've really identified some of the foods that have either come up recently as part of outbreaks or are seen as kind of riskier foods. So at the moment, I think we have about 26 articles up there. Others are in process. If there's not one there that you think is important to have, again, we'd love to hear about it so we can prioritize that. At the moment, we haven't, and Alice, you can correct me if I'm wrong, but I don't think we have a way of searching by pathogen. It's very much orientated to the food.
Yeah, that's correct at the moment. It's really, it is organized by food, and obviously there are pathogens which are more often associated with certain foods, but we don't have a feature that searches by pathogens at the moment, but I think that would be an interesting thing to explore. So the next question is, are the training resources for environmental health workers set up in a manner that new or prospective sanitarian or inspectors can use? And if so, where can one find these resources?
Yeah, so in particular in Colorado, we've developed a number that are really targeted towards new environmental health specialists or those that are new to outbreak investigation, so are kind of that introductory level, and then there are others that maybe are a little bit more advanced from that. All of them are on the All Products website. So for example, if you go to that website, click environmental assessments and select if you're particularly interested in a certain modality like online, it'll show which ones are focused on that. But again, we would be happy to hear more about what your particular needs are and would be happy to follow up with some specific recommendations. And that's really where we hope to get to with some of the curriculum work, is to make it much more easy to identify particular groups of people and have a whole set of recommendations for trainings that would fit that person. But yes, there are definitely trainings that are focused on an introductory level for environmental health professionals doing outbreak investigations and environmental assessments.
Okay, and it looks like the last question in the chat box for now is, are there any upcoming in-person trainings? And is there a fee for the in-person trainings?
No, so for the in-person trainings, similar to the online trainings, they are available free of charge. So for EpiReady, for example, all of the sites do EpiReady, and the way you would have the in-person training come to your particular jurisdiction is by reaching out to the contact for the CoE in your region. So there's a set number that they do each year. I see there's a question that was sent privately to me that asked about how many people we need. I think one of the things that the CoEs will try to do is see where there is demand, and then if it's a smaller group, they'll bring together perhaps people from 2 jurisdictions. So yes, EpiReady and other trainings, for example, in Colorado we offer one that's just 1 day that's specifically for epidemiologists, and I know there are kind of other offerings in other COEs. The best thing to do is be in contact with the coordinator from the COE in your region, outline exactly what your needs are, your time frame, and what disciplines would be interested in being part of this training, whether it's all team members or just epidemiologists, and they can help to find the best training for you and to see how that could be scheduled. Yeah, and we really love to receive contacts, phone calls, emails from anybody who's interested in accessing these resources. We're happy to spend the time. Part of our role is to be that navigator and to get you to the right training, and also just by hearing what some of the needs are really helps us in strategizing as we go forward as to what we should be focusing on. So really don't hesitate to be in contact and reach out.
Definitely. So with one more comment that training on EpiInfo would be nice. And I do know that Florida COE specifically has put together some videos and video trainings on EpiInfo, which I will add. I'm almost navigated to the page, and I will add that to the chat box.
Yeah, that's correct. So Florida, that's one area, an example of how one site has really focused in on a particular topic, like EpiInfo trainings, and they have developed a number in that area.
Hold on just a moment to see if there's any additional questions. Please do add them to the chat. But it looks like that might be all of the questions for now. And so thank you, everyone, so much for joining today. And thank you very much, Elaine, for presenting. So please do, if you've joined today, keep an eye out for that survey that I will be sending to you if you registered to provide some feedback on today as well as the future upcoming webinars. And the next COE webinar will be in November, and it will be hosted by the Minnesota COE. They'll be presenting on outbreak investigations using the COEs as a resource. The date, the specific date is still to be determined, but please keep an eye out for that announcement, which will go out through our COE listserv. And I did just add one of the EpiInfo videos, which should link through to some of Florida's other videos in the chat box for the person who asked that. So with that, I think we'll sign off today. Thank you all so much.